It could be the biggest vaccination effort the country has ever seen. Tonight, the early steps East Texas doctors are taking to stay ahead of H1N1. Good evening, and thank you for joining us. I'm Taylor HEMNESS.
And I'm Vanessa Centers. We're still targeting H1N1, which has already killed nearly 2,000 people worldwide.
Today, Governor Rick Perry said Texas is more prepared than ever to combat the virus, but the state still does need some help. Tonight, KLTV 7's Larry Livingston explains the help the state is looking for, plus what East Texas doctors are doing to make sure the vaccine gets here once it's finished.
The governor says we're ready.
We are more prepared than ever to handle the challenge. We know more about this virus now than we ever have before.
Governor Perry spoke in San Antonio today, along with other state officials, but the governor is also asking for more funding for antiviral medicines to help keep the virus from spreading, a valid concern here in East Texas.
If it continues at the rate that it's going, between a third to a half of people in the world could eventually have been affected by H1N1.
Dr. Jonathan MACCLEMENTS is the Smith County Health Authority and works closely with the Northeast Texas Public Health District. The state has already allocated nearly $17 million for local health departments. He says the Northeast Texas Public Health District applied for a portion of that money to help distribute a vaccine as soon as it becomes available and keep East Texans flu-free.
We really don't know what the fall will bring.
MACCLEMENTS says 5 companies are working to produce a vaccine by fall, just in time for cold and flu season, prime time for spreading. The goal, to keep new infections from overwhelming hospitals and clinics.
I believe we've already had people calling and wanting to know, do we even have our vaccine in yet?
Mother Frances Hospital Director of Infection Control, SYLVIA RADCLIFFE, says right now her hospital is trying to determine just how many doses it will need.
Our biggest concern is making sure we get the best information, and like I say, it changes on a daily basis.
She says a pandemic plan is in place just in case, your typical hurry up and wait situation. Larry Livingston, KLTV 7 News.
Health officials say the H1N1 vaccine will likely be administered in 2 doses. The CDC estimates about 45 million doses will be available nationwide by mid-October.